Hello, everyone. I'm Larry McNeely, Policy Director here at the Primary Care Collaborative, a national organization that convenes stakeholders from across the healthcare landscape that are committed to improving the nation's health by strengthening primary care. I'm thrilled to welcome you today to a discussion on cost sharing in primary care. We have a fantastic lineup of speakers for you today, but before we jump in, just a few housekeeping items. Like all PCC webinars, this webinar is being recorded and will be posted on our website, thepcc.org, within 48 business hours. You will also be able to find all of PCC's previous webinars on our website. We'll be taking questions today after our initial conversation using Zoom's Q&A tool, which is usually found at the bottom of your screen. Panelists will answer questions at the end of the webinar, but please do feel free to send questions throughout the entire conversation. Chat has been disabled for viewers, but our team will be providing links to relevant resources throughout the webinar. Also, the PCC is committed to delivering high-quality webinars, exploring important topics to the primary care community. We'd appreciate it if you took a minute or two after the webinar to fill out our post-webinar survey so that we can ensure we're meeting that standard. Now, I'd like to welcome today's moderator, Dr. Raymond Tsai from Purchasers Business Group on Health. Dr. Tsai is a Vice President of Advanced Primary Care, leading the PBGH's strategic initiative to implement advanced primary care in markets across the country, ensuring PBGH members and their employees have access to high-quality, cost-effective primary care. Raymond, thank you so much for joining and for moderating today's conversation.
Well, thank you so much, Larry. And I am very thrilled to be here for this important conversation. So thank you so much for PCC for hosting this and having me. Now, today's conversation on cost sharing comes at an incredibly important time. There's a new poll from Gallup actually just released last week that found that less than half of all Americans can consistently afford healthcare that they need. Now, that's a huge problem for us as in this country. So even as costs continue to rise, our nation isn't even getting healthier for it. And so it's becoming also an issue of poor value for both patients, but this is also affecting clinicians. I'm a family medicine clinician as well. And I can tell you that a lot of my colleagues are getting burned out overall. I mean, clinician burnout is at an all-time high. There's tons of red tape and countless billing requirements that just continue to pile up administratively and really impact the quality of care that clinicians can actually give their patients. It also chews into the time that clinicians have to spend with their patients, and you can't give good quality care in 5 or 10 minutes. That's not the type of relationship that really drives better health behavior. So ultimately, a lot of clinicians end up dealing with this moral hazard and decide to leave medicine altogether as they just get fed up with the system that puts too much focus on paperwork instead of actual patient care and instead of actual health outcomes. This entire system is also undermining the shift towards value-based models. Practices are really struggling to implement the different cost-sharing requirements, especially in innovative new programs, such as Medicare's very encouraging advanced primary care management codes. But this overall kind of morass of the system is really why today's conversation is so important. Policymakers and industry leaders need to understand how cost sharing in primary care is ultimately undermining the important work of building a healthier country through primary care. This is something that employers have known for a while now, which is why in my work at Purchaser Business Group on Health, we have as our number one strategic initiative to really what I like to call save primary care. Purchasers and employers have long been advocating for investment into primary care because they know a good foundation of primary care is really what's going to drive a healthier and happier workforce. So, besides the employer voice, though, I think it's really important to hear from other voices. So, I'm really, really thrilled to be welcoming three very powerful and unique voices representing the patient, the consumer, and the clinician as well. And so, I invite them to turn on their cameras as I introduce them. And so, first is Dr. Linda Delo, who owns and operates Delo Medical Associates, an independent family practice for over 37 years, and is now working for Conviva doing senior primary care. She's a past president of the Florida Society of the American College of Osteopathic Family Physicians and was a previous Florida Osteopathic Medical Association president who was honored to receive the Physician of the Year award in 2021 from that organization. So welcome. Also, Dr. Janae Johnson is a National Senior Policy Analyst at the American Heart Association, and as a member of the Policy Research and Translation team within AHA's Advocacy Department, she plays a pivotal role in advancing policies at the federal and state level that promote population health, with a particular focus on the more than 100 million Americans with cardiovascular disease. We also have Sophia Tripoli, who serves as Senior Director of Health Policy at Families USA. She is a strategic and innovative health policy thought leader who oversees and leads Families USA's strategic development and framework on all aspects of its health policy priorities, including guidance on federal and state health policy that will improve healthcare and health for all families and individuals in America. So thank you so much, everyone, for joining. There's actually a new bill, HR 8261, Chronic Care Management Improvement Act of 2026, that was introduced in April, that would eliminate the cost sharing that many people are talking about right now. And so lend your voice to that through PCC individually or through other organizations to support this movement on behalf of patient care.